Hi there, this is Gist Nigeria coming up. Medical negligence, holding health workers to account and exploring redress options for aggrieved patients. Also, tackling malnutrition. Start-up in Sierra Leone pushes the value chain of sweet potatoes beyond subsistence farming. And flying the flag. Nigeria's first decorated gymnast prepares for the podium at Tokyo Olympics. Plus,
hi, my name is Sheya Lawade. Check me out.
The marketing specialist supporting Nigerian creatives. Welcome to Gist Nigeria from the BBC and Channels Television, where we keep an eye on the stories making the rounds on social media. I am Wali Fakile. Let's start with our top story. Duty of care is one responsibility health workers owe their patients. How patients are received, cared for, and treated are all elements of this duty. But over the years, health workers in Nigeria have been accused of breaching this important duty, leading to medical errors that injure patients and in some cases causing their deaths. Despite what seems to be an increasing number of victims, there's been a low level of formal complaints or even lawsuits for compensation. How can society hold its health workers to account, and what options are there for patients seeking redress? Gist Nigeria's Ajoke Ulodse has been finding out.
The hospital, a haven of healing and life, is fast becoming a den of danger in many Nigerian cities. Almost everywhere you turn, a lack of empathy and growing disregard for the sanctity of life seem evident. It doesn't matter whether you visit a private or public hospital, the hope of healing is often doused by fear and trepidation. Vulnerable patients bearing the brunt for what appears to be health workers' disrespect for the Hippocratic Oath. Harrowing stories of negligence and incompetence abound on social media. Oftentimes, patients pay the ultimate price for mistakes that could have been avoided. In 2019, Onyi rushed her 9-month-old son, Raphael, to a public hospital in Ikorodu, a suburb of Lagos, the Nigerian commercial capital, in the wee hours of the morning. There were no doctors on duty, and for 7 hours, Raphael battled for his life, with no access to emergency care.
The nurse said there's nothing she can do unless the doctor is on seat. After an hour plus, the doctor came downstairs. We had to pressurize him into attending to us. He did not attend to us. It was just like he wants to go and pray. And he said there is no bed that he's going to refer us to General Hospital Ikeja. We said okay, we went outside, we saw emergency bus outside, and we came back that he should refer us so that we can get to Ikeja on time. Until around 10 in the morning, I went back inside. I noticed that the boy was not breathing again.
Onyi's story is not unique. Everywhere you turn, there's one sad tale or the other. The blame often left at the doorpost of uncaring health workers. Just 6 days to her 29th birthday, Omolara walked into a private hospital in Arepo, Ogun State, southwest Nigeria, to receive treatment for mild symptoms. Hours later, her condition deteriorated and she was rushed back to the facility by her friend Kara. Kara narrates the series of events that eventually led to Omolara's death on the 6th of May 2021.
When I got upstairs, I met Lara close to the bed where I was seated watching her. I was scared, and then at that time her head was down. She was not responding to me well. She was only giving me signs. I was really scared. There was no nurse on the floor again. I went down. At that point, the nurses were indifferent. No nurse even followed me back. The doctor told me that I needed to get a way to get out of that place, that they were going to refer her, that they cannot manage the situation. At the point where we were leaving, nobody said they were not going to give us oxygen until it was time for us to depart. They didn't give us any reason why they were not going to give us oxygen. They just said they were not going to give us oxygen. We even asked, who is even going to go with us? They pushed it on one another, and eventually, nobody followed us.
We have come to the hospital in Arepo to lay Kara's accusations before the authorities. The medical director, Abdulateef Ademola, declined to speak on camera, or consented to an audio interview. So she was in an emergency situation. Why was ambulance not available?
The hospital have ambulance, which you can cite on your own. But this issue we are talking about happened midnight, between midnight and 1 a.m. And the service was not available at that time because the driver couldn't be reached. Yeah.
This is a hospital that operates 24/7. Why was the driver unreachable at the time?
This is a private hospital. And private hospital, we have our limitations. Private hospital, we generate everything. We all know what is happening in the country. We are responsible for everything, for the road, for the... so we have our limitations. And that's why ambulance service may not be 24 hours every day.
She eventually got a vehicle to leave this place. Why was a staff member not attached to that vehicle, seeing that she was in critical condition? And why was she not placed on oxygen while on that journey, since she was on oxygen in the hospital?
She had been on oxygen. She had been pre-informed that the hospital is running out of oxygen, that the oxygen may not last long. And that was the basis for the referral, in the first instance. So the oxygen got finished about the time she's leaving.
Omalara's death has sparked renewed calls for reforms in the Nigerian health sector and accountability on the part of healthcare workers. Now, unreported cases of lack of adherence to ethical conduct and medical negligence means there's little or no data to show for what is fast becoming an alarming number of incidents of negligent care by health workers. So, what is responsible for this trend? The World Health Organization says medical brain drain, infrastructure deficit, lack of motivation for health workers, and poor working conditions are factors impacting Nigeria's health indices. Folajimi Adebowale has been a doctor for 14 years. He describes how hard it is for the average Nigerian doctor to be empathetic.
First of all, the doctors are not by any means interested in practicing in the country. In fact, if you see any doctor still practicing in Nigeria, please give him a salute, because he will make times 5, times 6 what he's earning outside the country. He will work in a more psychologically embracing system, a good system that supports his psyche, and he will most likely be demoralized. But working in this country in the healthcare sector is one of the most demoralizing things a human can face.
What is the Nigerian life worth? That is the question many Nigerians have asked for decades. Federal authorities claim they are concerned about rising cases of medical negligence, but insist that Nigerian medical workers are well trained.
Every doctor, every health worker is under a duty, as it were, to provide what is expected in terms of what a patient presents with, and that duty is always there to be carried out. And where that is flouted, of course, and the negligence is established, then whoever is concerned, and as a health worker, and particularly as a doctor, will have to answer for such a situation.
A culture of silence means erring health workers continue to work free without penalties or sanctions. In July 2018, the Federal Competition and Consumer Protection Commission launched the Patient's Bill of Rights, an aggregation of obligations of health professionals, medical facilities, and patients.
The long form says in detail what the facility must do, what is expected of a doctor, and the responsibility of a patient, including even to contribute to their own treatment. The idea then was that the hospitals would own it, the medical professionals would own it, and then, as it should be, they would take on the responsibility of propagating that.
3 years after, the Patient's Bill of Rights continues to exist in oblivion. On the streets of Lagos, it's hard to find one person that has a clue about its existence.
What is a Patient Bill of Rights? I've never heard of it before.
What does that mean? Like, I'm just saying for the very first time in my entire life. And if I haven't actually known about this, when I go to hospital, I will demand for it because it's my right.
With Nigerian patients barely knowing what rights to demand from health workers and medical facilities, enforcing their rights to complain when these rights are violated may present a problem. And if no complaints are made, erring health workers walk free and the deadly cycle continues. The Medical and Dental Council of Nigeria is saddled with the responsibility of regulating the practice of medicine, dentistry, and alternative medicine in Nigeria. Its mandate includes sanctioning medical officers who violate the medical code of ethics.
When complaints are made, the secretary of the panel will write to the complainant to put the complaint in form of an affidavit sworn to before a commissioner for oath or a notary public. That is when we agree that the complaint is properly laid before council. Then they will now investigate. In the course of the investigation, if that doctor is found to constitute danger to public health, that doctor is suspended immediately. However, if the doctor has no case to answer, the matter ends there. But if a prima facie case is established against that doctor, the matter is transmitted to the Medical and Dental Practitioners Disciplinary Tribunal that has them status with the High Court.
Analyzing violators of the ethical code may be one of the first steps towards sanitizing Nigeria's healthcare system. But what must be done to change the indices?
If we have a better funded system, there will be more doctors staying back in the country, there will be proper infrastructure for the hospitals, and there will be better personnel and facilities.
We need to motivate our health workers generally. But under whatever circumstance, it is important for particularly caregivers generally and doctors in particular to always remind themselves of the oath, the Hippocratic Oath, which essentially says the health of your patient shall be your primary concern.
Respecting the sanctity of life and showing high regard for the Hippocratic Oath has become crucial for every Nigerian health worker. However, patients must also learn about their rights and demand them. That way, Nigeria may come close to the healthcare system of our dreams. Ajoke Hulotsi, Gist Nigeria.